In trying to actually establish or confirm that a patient has cholecystitis, that's inflammation of the gallbladder, or cholangitis, okay, that's inflammation of the bile ducts, okay, you might actually want to do some things just to confirm 100% that, okay, these disease conditions actually exist, okay. So you opt in for imaging. You could do the ultrasound, you could do the CT scan, and another type of imaging that you could do is the MRI scan, okay. So looking at the MRI scan for cholecystitis and cholangitis, you are trying to look at the characteristics, how the MRI for cholecystitis will look like. Then you are also trying to look at how the MRI for cholangitis will look like. Then you are trying to look at what the advantages of using MRI to diagnose these disease conditions. They are trying to look at the MRI protocol. MRI protocol is like the types of versions of MRI that could be done and the possible results you are trying to do it for, okay. So talking about the definition, we say that MRI, also known as what magnetic resonance imaging scan, is a non-invasive diagnosis tool used to evaluate gallbladder and bile stones, and you are evaluating for what? Cholecystitis or cholangitis, okay. So let's talk about the characteristics of MRI in each condition. So if you do MRI for gallbladder, that's cholecystitis, it can help you visualize gallbladder inflammation. So the MRI can show what? Thickening of the gallbladder wall and the surrounding inflammation. Can I say the gallbladder normally should be like small to the size. Now if you have a big gallbladder like this, it shows you that there's inflammation, okay. Then gallstones, if there's gallstones too, MRI can dictate gallstones, especially if they are causing obstruction, alright. There are complications. MRI can identify if there are complications or if there would be possible complications. Because if you do MRI today, you look at the size. Do MRI in 2 days, you look at how fast the inflammation is increasing. It will help you to know if there's what? Complications close by. Alright? So MRI can help you identify complications like what? Gangrene, perforations, and what? Abscess formation. Alright? Then let's talk about the MRI for cholangitis. Of course, it's just like the same criteria, right? So it can show bile duct inflammation. So this MRI can show thickening of the bile duct and can also show if there's inflammation around it, okay. Then bile duct obstructions, MRI can detect what? Obstructions due to stones, tumors, or strictures, alright. The intrahepatic duct, MRI can visualize the intrahepatic duct, okay, and these intrahepatic ducts can be affected if there's inflammation of the bile duct, okay. So the duct inside is what we call the intrahepatic duct. The duct outside is what we call what? The extrahepatic duct, okay. So you can see this is what cholangitis, a normal bile duct, and you can see that there's an inflammation of the bile duct, okay. So why are we using MRI scan for this? Alright, advantages of using MRI for this: you could have high resolution images. It's a non-invasive method, right? So you don't really need to cut through the patients so they feel pain, apply anesthesia and all the stuff. You don't need those stuff, right? So it is non-invasive. There's no radiation involved. It can help you to dictate if there's possible complications or if there's an existing complication, all right? It can help you also guide your treatment decisions. You know the level at which the disease is, and you know how vigorous you need to actually take up the treatment and all the stuff, right? So MRI protocol is just trying to look like, if you're trying to find out for this, then you need to do this special MRI and all the stuff, right? So you have the T-weighted images. This one will show the gallbladder and bile duct anatomy. We have the T2 weighted images. This one will highlight the inflammation and fluid collections. We have the magnetic resonance cholangiopancreatography. This one is a specialized sequence just to visualize the bile ducts and the pancreatic ducts. Okay. Then we have the gadolinium contrast. This one will enhance the image quality and highlight inflammations too. Okay. Okay, so that's it about this MRI scan for cholecystitis. Basically, the characteristics of the MRIs to see if these conditions actually exist, advantages, and MRI protocol. So that's it, guys, and bye for now. MRIs.